Wilkes County is a special place filled with wonderful people. The Health Foundation is on a mission to ensure that every person here is healthy, safe, and able to thrive. With your help, we're tackling complex problems that no single organization or program could possibly solve alone. Wilkes suffers from one of the highest rates of overdose death due to addiction. That's why we were so pleased to have been part of the UNC Chapel Hill School of Government and Blue Cross Blue Shield of North Carolina effort to address the opioid crisis. This 2-year process is credited with us being able to customize solutions for Wilkes County so that we can address the scourge of addiction and its effects on families here.
So there is a large problem with substance misuse disorder in Wilkes County that needs solutions.
You can't look at someone and know that they have opioid use disorder. It can be your brother, your sister, your neighbor, the lady sitting across from you at church. You're not just going to look at someone and know.
So I definitely think that the disease of addiction is a disease, not just a moral failing. We really want to find the answer. It requires voices from all populations.
COPE is the Community Opioid Prevention Education Team.
Primary purpose of COPE was to bring various sectors together for individuals to talk about solutions for individuals with substance misuse disorder.
Working at the community hospital and being responsible for all of the clinical areas, particularly the emergency department, became pretty evident to me early on how much opportunity we have to improve the care of our patients in the emergency department, particularly those who suffer from substance use disorder.
So opioid use disorder is when you can't control the opioid use.
One of the properties of the medication that causes addiction doesn't just cause a mental or behavioral addiction, you're physically addicted to the medication.
So medication-assisted treatment is the gold standard of treatment for opioid use disorder. When you're in active use and you're using opioids, it's a constant up, down, up, down. So when you get into treatment and you're on methadone or buprenorphine, you're normal, you're level. So the medication keeps you level in here, so then we can focus on the counseling side. What got you there? What can we do to get you better?
We do not think that there is a cure. This is something that we feel individuals will have for the rest of their life. However, we do feel like there are solutions which can help lay the disease of addiction to rest. And as long as individuals have the support and the services and the things that they need, we feel like they can stay in remission from using substances and live a fulfilling life.
The difference that COPE made to me, again, as a relatively new person in the community, it put all of the key players in the same room.
I was thoroughly impressed at how many people were at the table. I think it was probably the first meeting that I'd been to that there were all sectors represented. We had law enforcement, I think we had a judge, we had town managers, we had police, so much of a diverse group at the table. It was refreshing that everybody was there and everybody seemed, willing to work on this project.
Health Foundation served as a huge backbone entity to all of the work that we were able to do. We were able as a group to get the right people to the table that I don't think would have otherwise shown up. We were able to really get the hard work done.
I am filled with an amplified sense of grace and gratitude for all that you, our donors, and our partners are doing to contribute to a healthier community. Learn more about how you can become a member at www.healthywilkes.org. And thank you for contributing to a healthier Wilkes County.